Good afternoon, everyone. We're going to wait one more minute while we have a couple more people sign in. Okay. Good afternoon, everyone. Let's see. Okay. My name's Martha Holland, and I'm the interim project manager for the Seniors Agenda of Santa Clara County. Our Seniors Agenda has a work group that's been meeting every first Thursday of the month since September of last year. And this work group focuses on bridging the digital divide for older adults in Santa Clara County. We have a group of approximately 40 professionals who represent various agencies throughout Santa Clara County. And we've been actively working on projects, proposals, programs, et cetera, that address the digital divide and focus on inclusivity for older adults. Today's lecture is the last of a three-part series that addressed various topics ranging from telehealth to the use of technologies in older adults. So now I am pleased to announce our moderator for today's event, Tracy Gott. Tracy's worked in the field of senior services for over 20 years. 18 of those years, she worked for the city of San Jose. She was overseeing the Congregate Senior Nutrition Program and other senior programs. Currently, she's working for the city of Sunnyvale as their community services manager, and she oversees the senior center, which is leading the age-friendly effort for Sunnyvale, therapeutic programs and coordination of neighborhood associations. Tracy's a member of our digital inclusion work group that I mentioned previously, and she's played an important role in our meetings as an advocate and someone who is committed to providing services to our older adult population in Santa Clara County. I would like to thank Tracy for volunteering to moderate today's event, and I would also like to thank all of you for taking time out of your busy schedules to attend today's lecture. And of course, I'd like to thank our wonderful presenter, Cami, who you guys will meet shortly. Just as a reminder, this lecture will be recorded and it will be made available on our various online platforms. So I will now hand this over to Tracy, who will go over a couple of housekeeping items, and she will introduce today's presenter. Go ahead, Tracy, it's all yours.
Thank you. A nice introduction. So welcome, everybody. We're glad to have you here today. So a few housekeeping items. You're going to be muted throughout the presentation, but if you do have any questions, you can type your question in the Q&A box throughout, or you can wait till the end. We're trying to just hold the questions until the end if possible, and at the end you can also raise your hand and you'll be unmuted so you can ask your question live if you'd like to. So I think today we're going to ask our first poll. We just want to find out what agencies are represented today. So Sonia is going to cue the poll, and we're just going to ask you to find out where we're coming from today. Oh, I was going to vote, but I can't. But I'm from a government entity. We'll give it a couple more seconds. And Sonia, will you let us know when the majority of people have done the poll?
Absolutely. It looks like most people have chimed in, so I'll go ahead and end it now.
Great, so we're a lot of community-based government organizations and some community members. Welcome, we love to see new faces here, and we hope that we can provide a lot of good information for you. So I'm gonna go ahead and introduce Cami. So Cami Griffiths is Executive Director and Co-Founder of Community Tech Network, a nonprofit with the mission to transform lives through digital literacy. With over 15 years of experience working in the public sector, Cami has developed a passion for helping people gain access and better utilize technology after witnessing firsthand how the digital divide and low literacy levels were aiding the cycle of poverty. She has worked for the City of New York Department of Parks and Recreation, managing 27 public access computing centers, teaching computer classes, and establishing their volunteer trainer program. As the training and outreach manager for TechSoup Global, Cami greatly expanded her knowledge and understanding of the nonprofit technology field, having conducted over 200 interviews with libraries and producing over 100 webinars. She's a founding member of the National Digital Inclusion Alliance, NDIA is much easier to say, and speaks nationally about digital inclusion. I should say before this started, I was talking to Cami and she said in the last year, she could probably add a lot of new things that they've been doing, especially since COVID has started of the new programming. So I will let her go ahead and share her information. We look forward to hearing what Cami has to say.
Thank you, Tracy. I appreciate that. Yes, National Digital Inclusion Alliance is a lot of syllables. So I'm going to quickly share my screen and get started on my presentation. If you've heard me talk about this before, you'll hear me say I love talking about digital inclusion and I love helping people get connected to the internet. It's something that I've been doing since 2003 and just got me passionate about helping people get on the internet and have been working towards that ever since. So it's an honor to be here and to be sharing what we've learned since COVID hit. I'll say a little bit about that's right, here we go. I had issues before getting my slides to move forward. Here we go. So I'm going to say a little bit about my organization, Community Tech Network. I'll talk about the need that exists for digital inclusion, which means access to the internet devices and training. And then I'll walk you through steps that you can take to get your community connected. And then we'll talk a little bit about how we can make digital equity a priority in our communities. And then there'll be time for Q&A. So a little bit about Community Tech Network. I'm a co-founder. We started it in 2008 in San Francisco. And 3 years ago, we expanded to Austin, Texas. So I live outside of Austin. And like Tracy said earlier, our mission is to transform lives through digital literacy. And we do that work entirely through partnerships with nonprofits and government agencies. So before COVID hit, we were partnering with senior centers and libraries and providing trainings in those locations. And we would do basic and intermediate digital literacy training entirely for low-income adults and seniors. And we also offered training for trainers that would be for hired individuals who are working for nonprofits and for volunteers. We also create curriculum and offer that curriculum out we license out the curriculum, and we've been able to translate our different curriculum into English, Spanish, Chinese, Russian, and Tagalog. So there's a lot of great work that we've done, and it's entirely focused on digital inclusion, and much of it has been focused on older adults, which I'll talk about in a minute. So before the pandemic, like I said, we were in person at all these different locations. We have a really awesome partnership with the Department of Aging, the Department of Disability and Aging Services in San Francisco, where we've been providing support at a network of senior centers since 2010. That was a big deal, or is a big deal. We're still doing that now. It's called SF Connected. We're just doing it a little differently, obviously. And then housing developments, workforce development agencies, community centers, and libraries. We were doing structured classes. And when I say drop-in help, we would make volunteers and paid staff available in those locations to answer questions as people popped in and popped out, sometimes with their own devices. But after the pandemic hit, we all had to just go home, right? And we were trying to figure out, how do we do this work remotely? And I know we all had that couple of months of like, whoa. So we went through that ourselves. We wanted to prioritize older adults who didn't have access at home. We didn't feel that we would be meeting our mission if we just focused on putting training online and leaving it at that. Because what about all of the seniors who came into the senior centers regularly for access because they didn't have access at home? They either didn't have access because they couldn't afford it or didn't want it in their home, or they hadn't really prioritized it. For a variety of reasons, they were lacking complete completely lacking access because of COVID. So we all had to go home. We paused our programming. We were able to do some videos for one of our partners, Curry Senior Center in San Francisco. They quickly were able to pivot and had us start recording videos. And we offered training for staff of our partners because they were struggling to help their staff members use Zoom. And we really decided that we needed to focus on internet connectivity, devices, and remote training for adults. So we ended up creating this program called Connect, which I won't go into in great detail, but we've learned a lot. Like everything you'll hear from me in this presentation is what we've learned from rolling out the Connect program. So I'm going to start with understanding the need, because you might think you know the need, but it's best if you collect the data from your community. And starting with like the big broad umbrella of the need that exists in the United States, and this isn't all that different than what you'll find in your own communities most likely, is this is some data from Pew Research on who has broadband at home. And the dividing line you'll see is age, it is income, it is access, the level of education, and then there's a pretty substantial suburban and rural divide. So, you know, there's not much I can do about the infrastructure, the lacking and internet infrastructure that is the situation in rural America, but I certainly can do something about encouraging older adults and removing barriers for them to get online at home. So a little snapshot of Pew Internet data. Here's a snapshot of Santa Clara County, and this is pulled from a free resource. And if you're a data geek, you're going to love this, that it will allow you to show visually data based off of both FCC data and American Community Survey data. It pulls a bunch of different sources to show you, and this is just one of many things you can visualize on this website. And this is showing homes with broadband subscriptions. So you can see that there's pretty good coverage all over the county, and there's little pockets where it's less connected. And you probably know that those are the communities that are most in need. So if you're wanting to prove the need to a funder or to a policymaker, this is a great resource for you to tap. Here's a sample needs assessment. There's a lot of words on this slide. I'm not going to read them, but the deck will be available for you and you can copy and paste this. This is a survey that was conducted in partnership with the Aging Services Council, which is a group of organizations in Central Texas, along with the University of Texas, UT. Because I'm out here in Austin, we created this list of questions, and these questions were delivered over the phone through service agencies when they made their care calls. And the information was logged in a safe, secure database that UT offered. And from these questions, we surveyed a total of 654 people. And here's some of the data that they learned: that 50% want mobile technology, that 21% had internet through their phones and only through their phones, and 15% had no internet at all. But that people did want internet, and they also wanted training if it could be delivered for free over the phone. So it's always good to take a snapshot, get some data to show to your your funders and to your policymakers. So I grabbed this slide from a presentation that was given to the Board of Supervisors back in August. I have an attribution down at the bottom that it was great to see that some data had already been collected for Santa Clara County. So I guess I'll point you to Diana Miller if you have any questions on the specificities of this slide, but it's great to know that you have already collected some data that you can work off of. So now that we've talked about what the need is and have a little data to work off of, let's talk about the steps that you can take to get your community connected. Here's some low-cost internet options. So there's sort of a chicken and an egg issue going on here. If I don't have a device or know how to use it, why bother paying for the internet? If I don't have the internet, why do I bother having a device or learning how to use it? So just know that you have to have both, really, these days. So I'm going to start with internet, and the service that we've used a lot, and that seems the easiest to sign folks up for is Comcast Internet Essentials. It has an online application, and you might wonder, well, if I'm trying to get subscribed to the internet, how could I use the internet? And it is a circular thing, but they have a phone number as well. But if you or your client or loved one has access to the internet, it is actually easier to sign up online. So what we're doing through the Home Connect program is shipping tablets with a hotspot, and then the senior can learn immediately, and then they'll be able, with the help of their trainer, go through the online application, take a photo of their eligibility paperwork, upload it, and run through the steps that are necessary. The phone call, you could have hold times, it could hang up, you could have a representative who's maybe has an accent and the senior can't understand, and then they're asking for paperwork that then has to be snail mailed in, and it just takes weeks and weeks longer to do the phone call. So same goes for AT&T Access is another low cost option, phone number to call, as well as a website. If you'd rather go the route of hotspots, there's two companies that do essentially the same thing, Mobile Beacon and Mobile Citizen. Mobile Citizen, you could purchase the hotspots in the service in kind of in bulk and be sort of the intermediary. And then Mobile Beacon, the intermediary, you could work through a company called, which I'll talk more about in a minute, PCs for People has this great partner portal that will allow you to purchase hotspots and manage them through their portal. So hotspots are an option, but the downside is that they could break if they are plugged in for a very long time. The battery will overheat and they'll break. And so that's a real issue. And then sometimes what we're seeing is that the power cord to the tablet is different than the power cord to the hotspot. And so the senior's trying to plug it in and they're like, it doesn't work. And we actually had one of our tablets come back to us broken because of that happening. So we've been labeling them, so it makes it a little bit easier to understand which cord goes to which device. So that's kind of a downside to the hotspot. The other downside is if you are sending them out as a loan, then you need to get them back somehow, and just the time that it takes to do that and the logistics. So you can also search for low-cost options, or you can search for internet options on these two websites. So everyoneon.org will showcase low-cost options, not just internet, but also where you could get low-cost devices and training. And Broadband Now it shows you all the services that are available by the zip code, not just the low income or the low cost options. So this is a very exciting opportunity coming up, the Emergency Broadband Benefit. You'll see it referred to as EBB, and it is in the process of being finalized. They're looking for internet service providers to sign up as a partner in providing this service, but essentially the government will pay up to $50 per month or $75 if you're in a tribal land to cover the cost of your internet. And that money would go directly to the internet service provider. There's also going to be a subsidized equipment. This will be eligible for folks who qualify for Lifeline, the Free Reduced Lunch Program, Pell Grant recipients, and those who have experienced substantial loss in income. And there's a couple other variables that they're still developing. I included a link to the website here. If this is something that, try to pay attention to it. Like, there's too many things to pay attention to these days. I'll be sure to be sharing it out with our networks, and it's going to be a game changer for real for our clients, because there's a lot of folks who just can't afford $10 a month. And there's a lot of folks who live in areas where they don't qualify for the low cost options, or they live in areas where there's no low cost options. So this is going to be pretty awesome. So if you're in a position where you are helping people sign up for the internet, some things to think about are understanding what options are available based off of their address and their eligibility. And this may take a little time. You may need to call up one of those numbers that I showed earlier and just understand if they're eligible. Problems we've run into are an address is actually in Comcast system as a business, so they don't qualify. or a lot of folks are living in an SRO whose landlord isn't exactly generous and isn't bothering to get the building wired. So they have no actual wiring in the building for internet. So there's a bunch of just like things that you'll have to deal with. Understand what the application process is. I mentioned this a little bit earlier that going through the online process will be easier than that over the phone, but just understanding what the process is. And then being able to sign up online is quicker, as I mentioned, or if you need to, doing a 3-way call is helpful. Sometimes the representative doesn't know about the low cost option, or they forget, or who the heck knows, but then they try to upsell the customer on something. So they might say, oh, okay, well, we have this discount. And it's actually like a 3-month thing that pops them back up to full price in a few months. So there's those types of things. Also, there's some 2 free months. So some of the providers have been giving 2 free months. So you want to make sure to ask about that if you can. And then keep track and follow up with the learner. If they did choose the phone call option and they say they're going to mail in their paperwork, double check that they actually did that. And the part of the process is actually getting them signed up, but then you have to get the router working. So what happens is the internet service provider will ship a box to that address with the router that needs to be plugged into the Ethernet port in there, or the cable box, or whatever the service is. And often the senior just has no idea what to do with this stuff. So if you or someone in some techie person in your world can help with that, either by talking through it over the phone or hanging out in the doorway with their mask on and giving some guidance that way, that will avoid them getting a fee. Because what we're seeing is if the senior says, no, just connect it for me, they're going to get a $75 fee. And this is from Comcast specifically. I'm not sure what AT&T is doing. But if they attempt to set it up themselves and then they say, oh, I couldn't do it, then the company will do it, will set it up for free. Or they might still get charged, and you'll just have to watch their bills because sometimes they get overbilled. We've had several people, somehow they think CTN is also Comcast, or that we're connected to Comcast, and so if they get a bill that's wrong, they blame it on us. So just beware that you might be seen as the bad guy because you're helping them sign up for Comcast, and then they're getting some bills erroneously. And so something that kind of took me by surprise. Some other internet options that I've seen, and then I'm going to pause after the slide to see if there are other ideas that you guys can share that I haven't covered. So I'm just saying that now so you can think and be ready to add it in the chat. So what we've seen from some housing developments in partnership with internet service providers, I've included a link here to a white paper that's a partnership between the San Francisco Housing Development Corporation and Monkey Brains, an ISP in San Francisco. And they were able to get funding through the California Public Utilities Commission to pay for the infrastructure that built out a network connected to fiber and a series of housing developments in the Bayview of San Francisco, which then led to the city of San Francisco launching this fiber to housing project, and it's all wonderful. So there's white paper there that goes over how they did that, and the residents are getting free internet. The city is subsidizing some of it, but it's just really amazing. And then Fresno Housing created a mesh network. And here's a link to a site that they put up explaining how they did that. And most likely, most of you are like, I'm not going to create a mesh network. I have no idea what that is, but maybe there's somebody in your network or a volunteer who's like a total IT guru and wants to give some time, and this would be something they might want to sink their teeth into. So if you are connected to a housing development where there's a lot of low-income individuals living either in a building or in a neighborhood, it may be an opportunity for you all to spearhead an initiative where you're creating a mesh network or somehow bringing in internet for all those folks that would essentially be free to them, but there would be a substantial cost to create it in the first place. And then buses as a hotspot. I know cities have been doing this across the country. Here's a story from Austin where school buses were parked outside of buildings to provide internet to folks. And libraries generally have always provided internet inside and outside their buildings. And so we're seeing that libraries are also lending out hotspots and keeping their Wi-Fi on all the time so that people can access it outside. So I'm going to pause and see if there are any suggestions or stories that you all have of other ways that you've connected to help your community connect to the internet. And Tracy, I don't believe I have any way of seeing the chat right now. I'm afraid to touch anything for fear of breaking it. So if you see any, if you see anybody add anything, will you please read it?
Yeah, I will be checking it. Somebody is asking about the slides, if they'll be shared after, and we will be sharing the slides after the presentation. So we will send an email when those are ready. So right now we're just looking for questions. If anybody has any ideas.
Actually, I have something to say, Cami. This is Martha. So I helped my mom recently connect not just to the internet, but we have family in Mexico, and they meet once a week to play card games over Zoom. And my mom did not know how to do that. And she was too shy, I don't know why, to ask, my siblings. There's 5 of us. And so I went on the phone with her and had her FaceTime me on her phone and show me. So we were just kind of working together, and she was so concerned because she knows we're all busy. But after about a good half hour, we were able to get her on. And I'm happy to say that she is now signing on her own, meeting up with her sisters in Mexico that she used to see maybe once a year. It's become a really, really great thing for her. Despite, the challenges of the pandemic and all that. But I mean, not really a community member, but family, I thought, and it was nice. It was nice to see at least, that I was able to help one person, my mom, so that was good.
That is good. And just think the joy and that's really a meaningful experience for her to get to interact in that way with her siblings. So that's really great.
Yeah. And I can share for the city of Sunnyvale and a couple other of our partners, we received a grant through SourceWise for evidence-based programs. And through part of that, we applied for funding to just get some tablets to loan out to seniors that were Wi-Fi enabled. So we've had some success, but with that was a big learning curve, because then we realized it's just not so simple to hand somebody a tablet and connect them, because then there was a lot more teaching involved than we were prepared for. So,
yep. And I'll get into training in just a couple minutes.
And I don't see any other hands or questions in the chat box right now.
Okay, great. So let's talk about devices. We already heard from Tracy that they had tablets that were Wi-Fi enabled, which is really a great way to start, is that you provide the device and the internet together in one unit. But what we like to think about is, what do your clients want to do online, and start with their need rather than like, oh, hey, let's get a bunch of Chromebooks for folks because they're the least expensive, or whatever I've heard it all from like, oh, well, we have these sitting around, we need to do something with them. Let's send them to seniors. To, it's just that you really don't want to try to send, Chromebooks are not the best thing for seniors, just to say it. It may be better for those to go to parents that are working with children whose schoolwork is on a Chromebook, and the only way to communicate to the schools is through the Chrome browser. So start with what they need to do. If they're doing some kind of job search or something where they need to use a keyboard, then get them a computer, a laptop. If they're consuming information like looking at videos or doing video chats, then a smart device and something with a larger screen, ideally for older adults, was going to be great. So if you think about the different devices that are out there, smartphones are, they fit in your pocket. They have everything you need to do for a bunch of stuff. They already are connected to the internet because of the cell service. And but they do have a small screen, and depending on your service, you may have a data cap or other things that the user should be aware of. That if you don't really understand what data is and you're not signed up for the right plan, you might get your bill and see that you have a huge bill because you were watching videos and you didn't know that you had to pay for data. So that goes for tablets as well. If the tablet has a cell connection through like a SIM card, you'll have that same data cap issue. potentially. So the tablets are better for, in some ways, they have a bigger screen. The touch screen is easy to use. Depending on the tablet, they could be pretty lightweight. But even if they are lightweight, we find that it hurts people's wrists to hold on to it for a long time. So you definitely want to get a stand for it to sit on, and so they don't have to actually hang on to it. And then Chromebooks are browser only. So if you're not aware of how Chromebooks work and you think it's like a laptop, you'll open it up and be like, why is this broken? Because it doesn't have a desktop like you're used to a Windows machine or a Mac. It is a browser, and you can't install programs like you're used to installing, although there's often apps that will work on Chromebooks that you can use the app through a web browser. So Chromebooks have a use, and but they're not always great for every population. And then other laptops that are Mac or Windows based that you have the freedom to install programs, and many people may already be used to those different interfaces. So we're often getting folks saying, hey, can I have a laptop? And we don't have many available. Like, we got a bunch of MacBooks like the one in this picture donated through Twitter, and we were able to give out almost all of them. And when someone comes to us and says, I'd like a laptop or I need one, I start with, are you used to using Windows machine or a Mac? Because the interfaces are different enough to be kind of challenging for someone to use if they don't have training. And then a desktop computer, it's the same interface as a laptop, but it takes up more space, and that can be problematic for folks who have a lot of people living in their apartment or their house, and they just don't have extra space for a big old desktop to be sitting. Some of the low-cost devices that are available, I apologize, there's a bullet at the top here that does not apply to Santa Clara County, but the city of Austin does have surplus equipment, but that's not going to help you any. So sorry about that. But I imagine, like the city of San Francisco, they have a virtual warehouse for their equipment. Perhaps Santa Clara County has something similar. We were able to get a donation of devices from a company called Revivin. There's a link here to them. They have a business where they take old equipment from companies and either refurbish it or recycle it. And they have a community program where they donate devices. So we were able to get 20 Chromebooks for a program that we did. You could also connect with colleges and companies and just your wider community for device donations. The benefit of talking to colleges and companies is they'll have a whole bunch of the same thing, which will make it easier to refurbish. But if you're not in the business of refurbishing, or you don't even want to think about that, you can purchase refurbished computers through either PCs for People or Human IT. And there's a bunch of other refurbishers out there. I call these two out because they're both nonprofits. The benefit of going with refurbish is that you'll get a more powerful machine for less money, and they often come with a warranty that these companies provide. You can also look at TechSoup for some of their hardware donation options. Distributing the devices is a thing you have to think about. So some of the options that we've used is to ship it directly to the learner. I was talking to a partner today, and they got a quote from UPS that it was going to cost $46 to ship a tablet within the same city. We were like, are you kidding me? So that didn't happen, but that's a cost. We're seeing the cost closer to $20 to ship a tablet with the training booklet together. You could also hand deliver. So here's a photo of my coworker, Stefan, giving a laptop to one of our lucky learners. And that's a way of doing it if it's possible for that to happen. And then some options we've seen are kind of drive-through and pickup kind of situation. So having a distribution where folks just drive up, and maybe you're having them text their information and you stick it in their trunk and they drive away. Not necessarily as much of an option for older adults, but it's something we've seen people do. And perhaps there's a way to distribute through health providers, that the health providers are encouraging patients to use their health portals. They're getting grants and funding for this, so there might be a partnership there. And we've also heard of agencies that have like apartments or housing where they have groups of folks all together where they can do a checkout system. And this is great for folks who don't want to have the tablet in their house all the time. They may think the government's listening to me, or it makes me feel uncomfortable, but they want to have access to it for their telehealth visit or an occasional, playing cards with their siblings over Zoom or what have you. So, so the tablet checkout system is something also to consider. Pausing for another interactivity, hoping that there can be some ideas from the community here on ways that you have been able to get devices. So we've heard from Tracy, who said they got some tablets donated. Was that through SourceWise, you said?
Yes.
So that's a great, yeah, if anyone says, hey, can I give you a bunch of free tablets? You have to first say yes, and then call me and I'll help you figure out how to deal with it. But it's just, I mean, if it's 10 years old, say, oh, that's so nice. But no, don't take anything that's really old. But if it's something that is just like 3 to 5 years old, then you maybe want to consider it. Anybody giving any examples on how they procured devices?
I don't see any questions in the chat box. I don't know if I'll see anybody that's raising their hand. Would that be me or you, Sonia?
No one is raising their hands. We'll both be able to see.
Okay.
Okay.
Well, if at any time you have an idea of ways that you were able to procure devices, please share that out and we'll lift it up here. When I give presentations, I always glean like nuggets of ideas from folks. So I think that it's always a good way to share out, if we can, what other folks have learned and what they're doing. So don't be shy and share those. In the meantime, I'm going to move on to training, which is in some ways the hardest thing, because you can get a device and you can hand that device off and you can get that device connected to the internet. But helping someone who's never used a smart screen remotely is just one of the hardest things we've had to do, because they don't, they're scared of this thing. They're going to break it. They don't know where to put, so it's an interesting time to be helping folks in this way. So what we're doing currently, and I'm talking from most interactive to least interactive, that are one-on-one virtual sessions is how we're delivering our Home Connect program, that we ship the device with the hotspot if they don't have internet. So they have the internet right there and then they get started. And our trainers call them up on the phone and they'll start a conversation and try to develop a rapport. And then the senior will have to turn the tablet on and get it connected to the internet, which is its own like mountain to climb. But once that happens, then they'll use TeamViewer or AnyDesk. These are screen share programs, and they also allow remote access. So if the senior's just totally not getting it, then the trainer can use the mouse to kind of point where they're supposed to tap. So that's how our Home Connect program is delivered, is one-to-one using the screen share. So there's no video, it's just audio through the phone and the trainer seeing the learner's screen. Then we have small group instruction. So here's a screen grab of training that's happening with clients from the Center for Elders Independence. They opted to go straight to classes. So what has to happen is someone on the CEI side ensures that the senior has a device with internet and they get it all loaded up with the Zoom. So someone is helping them do most of the setup. So it just is set up and working for them. And then the instructor, so this is Janelle, and she's delivering the training through Zoom with the support of CEI. So we often have like tech support when we do these small group sessions. And they may have needed to do even one more session before this to get the senior to even be ready to show their face. They might be so nervous. So there's a high level of interaction to get them to a place where they can engage in these small group instruction type workshops through Zoom. But once they get that and they figure out how to use Zoom, there's just a gazillion webinars that they could participate in right now. There's so many things to do online for free in different languages. It's really pretty awesome. So we just need to get them over that Zoom hump. And then even more even less interactive is our large webinars like this, right? You're muted, you can't do anything, you gotta listen to me yammer, but you hear good information, it's just there's not that interaction. So if at any time you're like, well, I'm stuck, there's really, not much that can happen. All the way down to recorded videos where there's absolutely no interaction, you watch the video and hope you understand what they're saying, and if not, there's nothing you can do because it's just a video. So, but all these are ways to get training content to your community members. And here's the outline of the training we offer through the Home Connect program, that it's 5 parts. It may seem very basic because it is very basic. There's folks who are just completely lost and they have all sorts of like mental blocks that they're too old to learn, or, so we want to really encourage them to coach them in being competent in all of this. So we start with the vocabulary and we help them search the internet safely. We talk about email, and we always talk about safety, that it's very important for them to leave these sessions understanding that there's misinformation on the internet. There are people who will email you and try to steal your money. And there are websites that are fake that are going to try to steal your information. So we definitely don't lay it all on at once because that would freak them out, but we do layer it on as they need to learn it. And then we also make sure that they understand how to use their camera and do the video chatting, because we absolutely want them to use this tablet to interact with the different classes that are available, to interact with their family members, and eventually, if they're wanting that, to do telehealth and other awesome activities. This may not apply to everyone here, but perhaps you are doing some work to provide help with getting jobs, but to think again back to the basics of, as a job seeker, what do you need to know how to do? So if you've never used a computer before, or it's been a very, very long time since you've used a computer, kind of understanding the basics of the device and how to use the internet safety, using email basics and word processing. There's a lot to know when it comes to job search, actually searching for what you're good at or what you want to do, and attachments and using USB drives, or using Google Form or Google Drive and saving your files on Google. So if you think about what it takes to even just apply for a job, there's a lot of kind of intermediate level skills that you need to have on the internet to do that. And I sound like a broken record because it's so important to be clear that the internet can cause harm and people are ripped off all the time, and it's a huge problem. So this is just something we have to be clear about with our clients, is that if you're new to using the internet, you have to be very careful about these things. So secure passwords, don't use the word password. And of course, there's plenty of websites now that require it to be 12 characters with the capitalization and the numbers and all of that. So we all hate passwords, but we know that they're good, that they're necessary. And then folks don't necessarily know to look for the secure website. So the HTTPS that shows the lock symbol. So anytime, if you're not already doing this, I find I do this just, if I'm on a new website and I'm putting in anything kind of sensitive, I double check that it's a secure website. And then having your device have an antivirus or some program to keep the malware and other things from being installed. And then in a day when we can leave our homes and use a public Wi-Fi, just remember that open Wi-Fi people could see your transactions. So to avoid using those public Wi-Fi for financial transactions. And then if you are in a public computer center, to sign out before you leave. When I taught computer classes a million years ago, I would often send emails to my students saying, you forgot to log out of your email again. So they would get freaked out that they were getting an email from themselves. So they would stop leaving their email up when they left the room. And then to really think about where you're getting your downloaded files from, that if you're downloading something, it could have other yucky stuff in there that gets installed on your device. And then always think twice before clicking on something that you get in your email. I know we all know this, of course, but that new users won't. And having them understand, hey, if you get anything, just ask me first. Don't click on it. And if you accidentally click on it, call me immediately. That it happens all the time, right? They get confused and they just click. So make sure that they have the trust and they can communicate with you, because the last thing you want to hear is, oh, I just gave my credit card information to this person, or I just mailed a check to this person. And then lastly, understanding that it's the data that's on your devices that's the most important thing. So if possible, have that data backed up in some way, those pictures and those documents. So now I'm going to pause again. I do like my interactivity. I'm trying to wake people up. Get off your email. Answer my question. So if there's been any kinds of training that your organization has offered, so Martha already shared that she helped her mom use Zoom to play cards with her siblings. I love that story. And it's very sweet that she didn't want to bother you. So other stories where either your organization or you personally have offered training to your community, or any other kind of stories that give us the warm fuzzies.
We have Santa Clara Senior Center mentioned that they use nursing students to teach one-on-one training to older adults. Thank you, Mallory.
I love that. Way to go. We're finding we have one volunteer right now from maybe two from a gerontology school at USC, and she is awesome. So we think, let's go talk to more gerontology schools.
Yeah, I found for the Sunny Senior Center, we do have seniors that call in who get stuck, and we had a fairly active computer lab. So we'll reach out to our computer lab volunteers and they'll connect with the seniors and help answer their questions.
That's great. So you're taking in calls and you're logging them and you're sending them out to other folks to address. It's kind of like a help desk in a way.
Sort of. And we've also had some students who have offered, but the challenge, right, is when you're closed, it's hard to recruit the volunteers and vet them, but students are we find very interested in helping.
That's great. Other ideas being shared? I'll say one I've heard a few times is through the libraries, at least the one in Austin. They were saying on a call yesterday, it was book a librarian. So they're in a similar fashion, they're setting 30-minute windows up where folks can call and work through a tech issue with a library staff. So that's kind of
no other question or no other comments yet.
okay. And there's one last thing I'll share, which is this concept of a digital navigator. Some of you may have heard about this. I think it's seen mostly in the library circles. But the concept is similar to what Tracy shared, is that can we provide a way for people to call in to a centralized location and get their needs met or questions answered in some centralized way? So the city of, I think it's Philadelphia, is doing something like this, and the state library in Arizona. It's a really good idea. It takes a lot of time and people power to get it off the ground. But if you can imagine having a centralized phone number where someone either answers it or they get logged in some way, the calls have to do with how do I connect to my Wi-Fi? And then you would put them in touch with someone who could answer their question. Or the question might be, I have 3 kids and we need 3 devices. How do I do that? And then again, you could put them in touch that way. So lots of good ideas, but who the heck has the time?
And there's one more, Cammie, I'm sorry.
Yes.
So Plaintree posted that their library is offering Zoom workshops on evaluating health information for seniors.
Fabulous.
City of Los Altos, now they're coming. The Adult 50 Plus program sets up one-on-one appointments with adult tech tutors.
Excellent. These are all great. So I'm curious what type of training, and this, I think Tracy, you mentioned the volunteers and how do you vet them? So if folks have anything they want to share on how they select their volunteers, or kind of any nuggets that folks want to share around that. Because while it is great to use volunteers, there's a process of finding if they're a good fit. Can they communicate these complex technology terms in a way that's not intimidating and off-putting, and patiently, and of course background checking and all that. So if anybody wants to share their nuggets on that.
That might be a whole other session, Karen.
It really is, and maybe I can do that next time. All right, I'm going to move on because I want to make sure we have time to open it up for questions if folks have them. So digital equity, so it's a big, big, big thing. And before COVID, nobody really knew that it was a thing. Like, I've been doing this for 13 years, and it was a thing since the late 80s. Since the internet became a thing, there were people in the community saying, we need to close the digital divide. And a lot of, through the years, more and more people got internet at home, and it didn't seem like it was a big deal. You want access? Go to the library. Well, the library is closed. So what do you do now? And now it's crystal clear that this is an issue, and it's not gonna solve itself. So how do we do more as community members, as leaders, as loudmouths like me? Like, what can we do to make this move forward so everyone who wants access has access? So some of the things that we've done and will do, I wrote there's an op-ed that was published, a story that the Mercury News published about our program. And this couple was highlighted, they're part of our program. So if you can get anybody in your program who's gotten access and the kind of success related to that, highlight it in your blog, highlight it and pitch it to newspapers. Get those success stories out there, especially like the before and after, like, I was struggling to get access to my telemedicine, or I didn't go to the doctor for a year because I didn't have access, and now I have access. So get real stories, write an op-ed. Here's a link to an op-ed from Austin that is just really, it's spot on. It was written by a professor who I'm now working with. And it's just these kinds of op-eds shine a light on the need that's out there. You can talk to your policymakers, talk to the state and county departments. I know many of them are listening, like, you all know it, right? Talk to your current funders, or as a coalition. I know that this is already happening, so I know I'm preaching to the choir, but let's just tell our donor bases that this is an issue, that these seniors are alone and isolated, and they would be interacting daily, if not hourly, with other people if they had a tablet that they knew how to use. We're getting great stories from our learners about people being just like feeling like all is lost. Literally, there's one of our learners who's like, CTN is a godsend. Like, I can't believe it was real. I thought it was a scam. Like, you're going to give me a tablet and internet and show me how to use it? What? So there's a lot of people out there that absolutely need this, and we need to tell the policymakers and the funders that this is a priority. And luckily, we have the master plan on aging. I was attending the equity, inclusion and equity committee meeting last week, and learned a whole bunch of great stuff that California is doing. It just warmed my heart how progressive they are in thinking through all of this. So the digital divide has found itself in this plan. So if this is something that you've been following, it looks like there's going to be, prioritizing funding for some of these activities. So we'll all keep a close eye out for these initiatives. And there's so much more I could say about making this a priority, but I think that, what we need to do is get our folks, do what we can right now to get them the connectivity that they want, understand the need, tell the stories, recruit volunteers and get them engaged in doing this work, or any kind of community ambassador. The thing we didn't talk about that could be its own conversation is, helping people sign up for vaccines, and how has that been for folks? So I'd like to just open it up and see if folks want to share, and I guess unmute themselves. And I think what I'm going to do is try to stop this presentation. Actually, what I'll do is I'm going to thank you. And here's my email address if you want to email me later. And the slide deck will be provided. And I'm going to close out of this so that I can see people's faces.
Okay, so I have a comment from Gwendolyn saying digital equity has been an issue for seniors in nursing homes forever. COVID shutdowns made it impossible to meet with seniors in nursing homes, and they're totally isolated. And then Mallory asked, how do you facilitate software and app updates with new learners? Oops.
And Cami, just so you know, because this is a webinar, you won't be able to see anyone's face.
Yeah, it looks like Cammie's connecting to audio.
Oh, got you. Okay.
It's that moment of silence for a minute. But if anybody else has any other questions, we can go ahead and type them into the Q&A box, and when she connects to audio. So, are you able to hear us now, Cammie?
So sorry about that. I did exactly what I thought I was hoping not to do, as I closed my window. So you were sharing something and I totally missed it.
Yeah, so there was a question about how do you facilitate software and app updates with new learners?
Software and app updates. So on a tablet, this is a real challenge. So when you are providing tablets and you want to download an app onto that tablet, often you need an email address to download it from the App Store. So you have to go to the App Store and then have an email address associated with it. So there's been this challenge because if there is an update to that app, then you need to log into that email address. And what we've done is there's some technical way of removing the email address later. And what I can do is get the name. I'll provide this as a follow-up to the group. I know that my staff have figured out a way to add these apps without attaching it to an email address, therefore causing this issue of needing to log into that email address. Because you really need for the apps to be associated with the learner's email address so that they're getting those updates, or that when the app is prompting you to update it, that they can then log into their email if they need to. So it's a challenge. When you're on a computer, it will nudge you or sometimes do the auto updates. And we encourage people to read everything before they click through, and if they have questions, to contact someone. But that if it's a Microsoft update or some update from an application that they know and trust, that it is okay to update that. So if I could, so Tracy, maybe I can get the name of that person, or Martha, we can send out a message later to the group.
Okay, we can do that. Were there any other questions? Here we go. There's a few more coming up. So seniors are intimidated by what has happened to them in the past with their devices. They've gotten stuck in a place they can't get out of, so they stop using it. Post-COVID, do you have resources to send people to homes to help?
We're not sending anyone to people's homes. That was my initial idea before I realized how serious COVID was. So our work is only through remote, right? So having the call in the phone, was that the question?
I think they're asking after COVID.
Oh, after COVID.
So would you have resources?
My board is not eager to have us go back in person fast. Like, we want to be really thoughtful about keeping everybody safe. I think what we've learned how to do this, we knew how to do it in person before COVID, and there's some train the trainer topics we could discuss, like how do you prepare a person, a trainer, to be really excellent at working with older adults. That having someone who's not patient, who insists on using jargon and showing how smart they are, these would not make for a good trainer. But having someone very calm and being able to understand the situation that an older adult faces when it comes to technology, and understanding that they've had some negative experiences in the past. So much so that they may have said 5 years ago or whenever, I'm never doing this. This is never going to stick their foot down and say never. But now they're maybe warming up to it. And the last thing you want to have happen is that they get burned again. So I would be happy to present later when we're in a position to talk about doing something in person that, what are best practices around that? Having people go into homes is tricky for liability reasons, but if your folks are already going into homes, then providing training for trainers who are already going into the homes is something we've already done. Prior to COVID, back in 2017, we worked with Little Brothers Friends of the Elderly and created a curriculum and trained the trainer for their, what do they call them? Their friendly visitors. They would already be meeting up with the seniors and going to their homes and grocery shopping and whatnot. And this just added the layer of, now we're giving you an iPad and helping you sign up for the internet. And this trainer is going to show you how to use the iPad. So we've already done that work and have some insight. And again, I'd be happy to share later with folks.
Thank you. And then we have a comment from Brandy over at Institute on Aging. She says that the Institute on Aging social worker team works very hard to arrange services for their clients. Vaccines and testing are included, services for those enrolled, but it's challenging for those who have no technology access.
It is challenging. I mean, it's impossible, right? If your clients are on the phone and that's it, then there's no way they can log in and do anything. I've heard of these angels, these vaccine angels, the folks that are making phone calls on behalf, and they're over the phone and they're helping sign people up remotely. But really, whatever we can do to get devices and internet into the hands of everyone who want them, and those who don't want to be connected, work on helping them understand the value of the internet, that it's not just for kids, it's not going to steal your identity if you're safe. It's not just for games, that maybe we need some ambassadors from the community to share why having the internet now has made a difference in their lives. Beyond playing games with friends on Zoom, they're finding any video pretty much they want on YouTube, or being able to start to write their memoirs. This is another thing we're hearing a lot of people doing is kind of writing their stories, or hobbies, or really any number of things that we take for granted. But some folks just don't know that that's what's available on the internet. So, as we do more work with our clients, like having an understanding of their connectivity from the very beginning. So as you do your intake, knowing, do they have a computer or a tablet? If they're only using a smartphone, perhaps one of the programs we enroll them in is this program that provides them a tablet, or that type of thing. And I understand the cost involved in that. Maybe it's a checkout program where for 3 months they get to check it out, and maybe they have enough money to purchase one on their own, or maybe it's a partnership with a big tablet provider who will give you discounts. So, again, to the making digital equity a priority, what are the things we collectively can say to a big tech company and say, there's 5,000 seniors or whatever the number is in Santa Clara County who are lacking access. They're at risk for isolation. This has negative health outcomes. What can we do together to help this community? So it's just a wonderful thing what you all are doing in your working groups to build up the knowledge of the need, and then share out this capacity building like this webinar, and helping others know how to do it as well.
Thank you, Kim. There's one more question. It's is any organization reaching out to family caregivers to help their senior with these issues?
So we're currently hopefully soon, signing an MOU with Stanford Hospital to help 10 caregivers as a pilot. We haven't signed the MOU, so hopefully it'll happen. But that's the training for the caregivers, and it's the basic digital literacy training for the caregivers. What we're not talking about is, as a caregiver, how are you going to help the person that you're caring for? But I'd love to have that conversation with any agency that's supporting caregivers, because caregivers range in all ages, but we know that many of them are in their 50s and 60s, and they are struggling with work, and perhaps they still have kids in school, and they're juggling a lot. So is there a way to help them gain the confidence on specific tools that they can then show to their older adult that they're working with, how to help them at least do FaceTime or something that's really simple? But we also understand the dynamic between adult children and their parents, and that may not always be the best fit for the success of an older adult getting the training and support that they need. So, yeah, I'd love to brainstorm if that's something that's of interest. How do we train the trainers to then work with their with the folks that they're caring for?
Thank you. See, I don't see any other questions being posted, but if they have a question they want to raise their hand or put in the Q&A box. I think there's lots of new topics that Cami will come back with and present next time. So it's great to get, it's always great to get ideas, right?
It is, and I do enjoy sharing what we've learned. And if I can help someone avoid wasting time on something, or, you know, the worst thing I've seen is, or one of the worst things is jumping in to offering a higher level training than the learner is ready for. And then they start to have those insecurities and the feelings of, I can't do this, and then they give up. And it will happen. So just be very careful as you're entering them into this world of the internet, that they're going to be intimidated, they're going to be scared, they're going to want to quit. And we have people quit all the time. It's really, so with the Home Connect program, we provided tablets and training to 200 people since end of April. And we're hoping to do like 30 a month, 40 a month, if we can get our systems working. And the more we do it, the more we're seeing, okay, people are saying, no, thanks. And we're not sure why. And so I think they get scared, and then they're like, I don't want this. So we even have to be, we have to be careful. And we may be doing something that is inadvertently making someone get overwhelmed. So it's a real thing. What you don't want to have happen is that they give up and they don't want to do it again for a very long time, or that it creates other self-esteem issues. And it would just be very sad if your hope of getting them online turned into something that ended up being a negative situation.
I think that's a great point you make, because I think a lot of people underestimate how much time is really involved in trying to train somebody and trying to teach them how to connect. So.
Yep, exactly. And one thing I would add that we're learning is one size does not fit all, that some folks come in knowing quite a bit, and all they need is a little extra. So maybe just a half-hour call with someone, answering questions on how Zoom works and how you're not supposed to close it out when you're in the middle of a webinar. And that's all they need, and they're good. And then there's going to be folks who have had an email address, but they never check it. They don't really know how to use their tablet they got given to them last year, and they need a little more support. So maybe 3 or 4 hours with one-on-one is all they need to get them ready to do these kinds of Zoom sessions. And then there's folks that are like hardly literate in their first language. They may have physical and cognitive disabilities. And so, really figuring out what's the right need for that person and how do I help them get there? And if it's that we need to wait until after COVID and we have someone physically go into their home and we help them do a video chat with their family member, and we take the tablet with us because it freaks them out to have it in their home. And we just make it fun. Hey, let's watch a video. Who's your favorite actress? Let's watch a video, And then they start watching the videos, and then they won't give that back. You want to keep this. I want to play with this. And then they might stay up all night watching videos. So, it's great if you can get folks to a place like that. I did have some adult child complain on one of these sessions that I did that, well, now my mom is staying up all night and she's not getting sleep because she's on her tablet all the time. I'm like, great. She's online, she's doing stuff. I mean, it isn't great if they're getting in, getting into things where they're giving out their personal information, right? So that's where you want to be thoughtful or getting tricked by folks. So again, keeping the trust and the lines of communication open so that they can tell you if something bad happened, and that they don't feel like they're going to not want to tell you, but they have to tell somebody. So if it's not you, then maybe the network of volunteers that they're working with. So yeah, there are those things that happen. We have to be careful to.
I think I have a comment and then a question. So during the pandemic, then we've been able to see some of our clients, mostly who have dementia, get used to using tech daily to attend our Zoom programs. It's been great to see the progress in both our clients and family caregivers, but they agree it's important to boost that confidence by being kind, patient, and consistent. And then the question is, are the trainings specifically directed for older adults, or are they transferable to all ages?
The training for Home Connect is for older adults. It's very slow, and the resources that we go to online are specifically for older adults. So it's not transferable, but the curriculum wouldn't be that difficult to make, to augment it by changing the links, adding a few more activities. But since it's for a tablet, a younger audience may be more interested in a laptop because they're doing job search. So if they want to do job search, or if they're a parent struggling to communicate with the school, then what you'd be teaching is very different than the Home Connect curriculum. So start with, what does the learner need and how can technology help them get there? What are the tools, the actual hardware, but also software that they need to know, all while coaching them and making their confidence, building their confidence. Because even younger people have negative experiences with education, and setting them up in a classroom might trigger some negative event that happened when they were younger. So there's going to be junk that other folks are dealing with, even if they might be in their 30s or 40s. So yeah, just coming from a place of technology can be really great, and it can also be really frustrating. In always relating to them, I think, helps.
Okay. One other comment to share that you made great points, and thank you for your time and information today. So I agree. So I think that is the end of our Q&A. And do you have any closing comments, Cami?
Say thank you for being here and for caring enough about older adults to help them get connected. That this is hard work. It can be very expensive. You might feel like, I don't know the first thing about technology. Why am I the person doing this? So we're all kind of accidental techies in some ways, but just know that my agency is here to support you. We have a lot of smart people who care a lot about this subject. So please lean on us. And, I'm happy to do another webinar like this to know that what we've learned is helping others just makes me so happy. So thank you for participating, and do let us know if you have questions.
Thank you so much, Cami, for taking the time to share your information. It was great, and I learned a lot. So we look forward to having you back in the future and doing more webinars like this. So I think I'm going to turn it back over to Martha, and she's going to talk about some upcoming announcements.
Okay, I'm back. Cami, that was awesome. Thank you so much. That was a great, great presentation. It's very, very obvious that you love what you do, and you're providing so much good work and connecting all these people and providing all this useful information. So thank you so much. We might take you up on your offer and have you present somewhere in the future again. So thank you again. Okay, so everyone, I'm here. I'm back again. I'm going to give a couple of announcements before we end our webinar today. Let's see. Can you guys see my screen? I think you can. Okay. Announcements. First announcement is the American Federation for Aging Resource. Hold on, let me move this because I can't see here. They're hosting a seminar on Tuesday, March 30th from 1 to 2 Pacific time. So research shows that gaming may actually help us live longer and optimize our brain function. So there will be individuals at this event that will be speaking on bettering lives and living a longer and better life. And there's Chief Editor-in-Chief Sarah Smith will be joined by 2 experts who are leading the exploration of gaming cognition and healthy aging. So that seems like an interesting seminar. So you can RSVP at the amy@afar.org, or you can go to their website for more information. This is our Dementia Friends information. So hop into action and become a Dementia Friend today. You can go to the Dementia Friends website, dementiafriends.org, to get additional information. We are trying to reach at a goal of, it was 2,000, but now it's jumped up to 5,000, which I'm pretty happy about. We are trying to get a ton of people a little bit more aware of what's going on and get additional information in regards to becoming dementia friends and learning more about dementia and other related issues. So we encourage you all on this call, and also, spread the word by going to dementiafriends.org to become better educated, learn how you can become a dementia friend and help our communities. So go to dementiafriends.org for more information, or you can always go to our age-friendly Santa Clara County website for additional info. Okay, my thing's not advancing, hold on. Okay, Older Americans Month is the month of May. I almost said next month, but next month's April. So save the date, May 6th, 10 a.m. The theme for Older Americans Month is Communities of Strength. Sorry, I just saw my face here. Communities of Strength. And excuse me, we're gonna have Doug McConnell host this. He will be our speaker for Bay Area Backroads. He will be discussing time and nature, just what the doctor ordered, pathways to health and happiness. So you can email the Senior Center at sunnyvale.ca.gov for more information. Tracy, who was our wonderful moderator today, is helping in organizing this event. So it is going to be very good. So if you want additional information, email the Senior Center, look for this on in our newsletter that's coming out in a couple of days, or you can always go to the excuse me, Seniors Agenda website for additional information. So following that event on Friday, May 7th, we're very busy in May, as you can see. We are hosting, when I say we, I mean in collaboration with the Public Health Department. Seniors Agenda is hosting a brain health symposium from 10 to 11:30. So we are very excited to have Dr. Robert Oldham. He is the department director from Placer County, and also Dr. Patrick Arbor from Institute on Aging, who will be speaking. We also have Susan DeMoris, sorry about that, the California Policy Director from the Alzheimer's Association. We have a pretty robust agenda that day, so we would encourage you all to please attend. There's going to be some great information, so save the date. More information to come. Also will be included in our Seniors Agenda newsletter. Another save the date, we have our Network Summit. More details to come. That's a little bit further out, August 25th, but save the date because these are always good. So I believe we have a topic, but we're not going to share it just yet, so stay tuned. And as always, we want to encourage you to sign up for our Seniors Agenda newsletter. You can go to the age-friendly Silicon Valley website. And again, we have tons of useful information, resources, great events that are coming up. A lot of our community partners, we like to highlight their wonderful events that they are hosting. So please sign up for our website if you are not already on there. And we encourage you to share this information with your colleagues as well. And finally, this is the last one, yes. Follow and tag us on social media. So these are our handles. Follow us on Instagram, Facebook. You can tweet us, whatever. Yeah, tweet us. Or anyways, go on Twitter. These are our handles, hashtag Seniors Agenda and age friendly, all that good stuff. So you can do searches and find us all over the internet. And finally, I would like to thank all of you for joining us. And I would really like to thank Cami and Tracy and Sonia behind the scenes running all the webinar stuff, and everyone else that I have not named for joining us and helping us. This is our first ever series, digital inclusion series, which I think was pretty good, turned out pretty well. So thank you so much, and hopefully we can continue this tradition, and next March, maybe you can join us again for a whole new set of, informative presentations. Maybe it's on digital inclusion, or maybe it'll be some other topic, but seems that we might keep this tradition going. So thank you so much. Thank you for your time, and everyone be safe. Take care.